Hey, good morning everybody. This is Dane. As you see, I have, look at this, Technicolored. Technicolored, that's all I can have because I really need to get some more socks. I'm so poor anyway, so I'm gonna get some socks. Basically, I cannot find the color, the other pair of this, so I just went ahead and got another kind, another color, so it doesn't bother me at all. I do not go anyways, just around the yard. Welcome back to my channel, Philippine Nurse Retires Home. Anyhow, today's topic will be very different from what I usually talk about, which is landscaping, how beautiful they are, my mowing, and so on and so forth, building the house. That's gonna be later on. Let's talk about the current trend that's brought about by the COVID. Okay, it's about the way you deal with your physician's office visits. Okay, currently they're doing it over the phone, unless necessary that you will be seen in the office. The reason for that, because of the social distancing. So they pretty much call you at home or in your office and do that conference, teleconference, and they will give you all the lab result. If you're diabetic, they're gonna adjust your medication according to your levels of your lab works, or cholesterol, or anemia, or something like that, your CBC. They're gonna adjust those, so they don't have to see you in the office. So that's what they do. Otherwise, I'm gonna talk to you about the advantages and disadvantages. I'll talk to you the advantages first. Number one, you don't have to have a like 2 hours wait time in the office, and it is really aggravating to be waiting and wasting that 2-hour time. In our case, because it's a small city, maybe 1 to 2 hours. That's the kind of the usual time you will see your doctor, and then they only see you for about few minutes anyway, right? About 15 the max, if there's even 15 minutes for each patient. And that's the advantage. You don't have to have a lot of wasted time. Number two, they can call you anytime in your telephone and go over with you the lab works. As I have said, they will give you this abnormal or abnormal. Okay, they don't have to see you on those cases. You can also call their office and get an appointment according to your likeness, according to your basically according to your time. So you don't have to take off from work, so you're gonna lose time and money, right, when you do that. And when you have like a minor complaints, then you can just call the office and talk to them about it, and they would hopefully just order some antibiotic for you, or anything like respiratory treatment, something like that, if they know your history. So it's very convenient to have that, and it probably would cut down a lot of electric bills for them and water bills, right? Because if they would have to maintain their office, lots of patients, meaning equal to more electricity on their part. The bill would go up, as well as the water flushing the toilet, and so on and so forth. All right, we'll talk about the disadvantages. Number one, you don't see the doctor. You're only gonna hear him over the phone, so you do not have that kind of interpersonal relationship, no rapport between you and the doctor, because you don't see eye to eye. So you can tell him how you feel, and really you cannot even really ask too much question, because they probably have only little bit of time to talk to you over the phone. They're always in a hurry. I know that because I did that before. So you have some sort of productivity issue in the hospitals or offices, all right? So you're only given a certain time to talk to your patients. So you don't have physical examination, which is very necessary. They're not gonna get your vital signs. So when you do the office work, they have to get your vital signs and then determine if your blood pressure is abnormal or not. How can they do that if you are gonna be on the telephone? Not all people check their vital signs and they don't even know what's normal and abnormal. Okay? If you're diabetic, high blood sugar like that, it's okay probably based on the A1C. But the lab works is not enough to determine the patient condition. You have to really look at the physical condition of the patient. So there's probably a lot of stuff also that are missed during the telephone call, because sometimes during office visit you would remember stuff and you talk with your doctor about your concern. All right, so as I've said, there's no physical examination. So what if you have some growth in your boobs, or you have growth in your private areas or organs? When they do physical exam or auscultate your lungs and so on, that can hear abnormality, then that time the doctor was more effective doing that by sending you for special care, like more intervention like x-ray and so on and so forth. That needs to be addressed. Another disadvantage is, what if you're old and not able to really talk to your doctor about your symptoms? Some patients do not know how to express, especially for people like me who has difficulty with communicating. And I hear and I see that all the time while I'm interviewing patients. When I interview patients for surgery, it is the most difficult thing to talk over the phone when a patient do not understand you and you don't see the patient. It is so hard to interview them, how they feel, and ask them about the history. That's the most difficult thing. Even if you're gonna have interpreter, over the phone is so hard. So, and then what if the patient is deaf? They cannot hear you, and you have to use the kind of machine again to help you with the deaf patients. So there's a lot of issues that are missed when you do telephone calls. Anything else? Those are the basic stuff that I'm really concerned about. But I bet you with the current situation, they probably are going to use this kind of management later on, and we will see. But there's always gonna be exception to the rule. You probably can be seen immediately if you're required to be seen, but as I have said, there's exception to the rule. But this time, that's all what we can do, how to protect ourselves, because those frontliners are getting infected, doctors and nurses. So I can feel for them. So anyway, what's your thought? And I hope things are okay, doing well with you, and you better be very concise with your doctor when you talk on the telephone. And don't be stressed out, and really they need to spend time talking to you. Otherwise, have a good day. Thank you. Bye-bye.